So in this next video clip, we're going to look at some of the basic examination procedures for looking at hip abduction. So we'll have Amanda start with an active sidestepping procedure. And at that point, we're going to roll behind the patient and analyze the active motion, in this case, analyzing active hip abduction. So Amanda, if you begin sidestepping. So we give the patient stability by having them hold onto a table, and we look to see if there's equality in the amount of abduction from each side as they perform the sidestepping procedure. And you can see in Amanda's case here, she's able to abduct well to the right, but she's showing less abduction to the left. At this point, you can come in, and on the side where she wasn't abducting as fully, we'll have you bend your knee. Okay? And I'm just going to hold your leg like this. And I want you to bring your thigh toward me. So we have the patient actively abduct their hip. And now we'll determine whether or not a pain impairment in the direction of abduction was limiting her abduction motion. So at the end of her available active motion, we'll come medial to the knee and give a little quick motion like this. And that's our overpressure test. If that was painful for the patient, we'd have a good sense that a pain impairment might be limiting this movement. Now, how about a stiffness impairment from an osteoarthritic process or any other process which might shorten the capsular tissue at the hip joint? We'll bring the hip back down toward midline just a bit, and we'll begin the process of studying hip abduction all the way to the first and then final stop. We'll do this bilaterally, but if the end of abduction comes early and the end feels firm to us, most likely we're dealing with some type of capsular shortening as the principal reason why the patient was not able to abduct fully on the left side. In order to be complete, we also want to be sure whether or not there was any muscular weakness affecting the hip abduction motion. So we're going to ask the patient to carefully transition up onto the table. She'll lay in right side lying. Bring the underneath leg up just a little. Straighten the uppermost leg. I'd like you to actively lift upward. Okay, just do that a couple times for me. As we do that, we can palpate the muscle for atrophy. I want you to abduct one more time and hold as hard as you can now, okay? Don't let me move you. And we do our standard resisted isometric strength test to see if the reason for limited abduction during the sidestepping procedure had anything to do with weakened proximal hip joint muscles.